Thank you, Chloe, and thanks for that introduction from you, Ash. And thanks for inviting me along to speak this evening about an issue which has, I guess, occupied a significant amount of my time over the last 7 years since I was appointed as the Executive Officer for the Yarra Drug and Health Forum. So, just for those of you who don't know, the Yarra Drug and Health Forum was established 21 years ago, and it was established in the city of Yarra in Melbourne, which is an inner city suburb which has a history of, I guess, traditionally, I suppose it's been working class, but over the last few years, it's certainly gone through a massive gentrification process. And it's also got a history of having a very strong connection with open drug markets. And in the mid-90s, when there was a significant amount of heroin around Melbourne and the rest of Australia, there were several street drug markets that emerged in Melbourne. One of them was in the city of Yarra, and it was in Smith Street. And the situation at the time, I guess, was very confronting for a lot of people because Melbourne had several places, including Smith Street, where heroin was being sold and purchased and used quite openly. So, and this, of course, as I said, was very confronting for the community, and there was a major inquiry into illicit drugs at that time, the Pennington Report, a number of recommendations from that. But at the grassroots level, people were just really unsure about what was going on, and they wanted to know more. So several community meetings were held, and from that, the Yarra Drug and Health Forum was formed, and it really was, I guess, an organic grassroots response to illicit drug issues in the city of Yarra. So meetings became more regular. There was a secretariat or administrative position created, and people could come along. Anyone that lived, worked, or connected to Yarra that wanted to know about illicit drugs could come along and talk about, what was going on. And it was actually the Yarra Drug and Health Forum back in the mid to late 90s that first, I guess, suggested or proposed that we have an injecting facility in Yarra. And funnily enough, it was actually a local police officer who'd read about them overseas who suggested it might be worth looking at. And from that, there was, I suppose, a lot of interest created around injecting rooms. And towards the end of the 90s, in Yarra and about 5 other places in Melbourne, legislation was proposed that supervised injecting facilities would be established. There was, I think, the city, St Kilda, Footscray, Frankston, Springvale, Dandenong. There were several places where there was an open drug market, hotspots as they were called. Unfortunately, the legislation was defeated in the upper house, and not long after that, in the early 2000s, the North Richmond market started to grow. And it started to grow because it was believed that it was the perfect environment for a street drug market to survive and thrive. So we thought that would be pretty straightforward. We thought, okay, here's the evidence. The council supports it, the residents support it. Let's just do it. Unfortunately, we didn't. I guess we weren't expecting the significant political backlash that we got. Not only just backlash in terms of the usual sort of comments about well, it sends the wrong message, it undermines the anti-drug message, even some ridiculous statements about, well, these, we'll just draw in more people, there'll be a bigger market, even that sort of a commentary was forthcoming. We actually, in the end, got no engagement and a flat no from the government. So we acknowledged that in terms of the consultation process, we probably should have engaged with the politicians, the government a lot sooner. But I was quite astonished that basically we got a brick wall in terms of any engagement around this. So the discussion was shut down pretty quickly. So what we thought was a straightforward solution to a complex issue has become a protracted advocacy campaign, which I'll talk about a bit later. But we have found over that period of time, since 2011 up until now, that we've had our ups and downs in terms of media coverage. We've had our ups and downs in terms of people who have supported what we've set out to do. Wavering from time to time, saying, if the government doesn't want to do it, we're wasting our time. So, but it's something that we intend to pursue. The issue in North Richmond and now Abbotsford is probably worse today than it's ever been, and the evidence since that time, since the council voted in favour of an injecting facility, which we have also gathered in terms of further reports from the Burnett Institute, clearly demonstrate that it's warranted. Marion Jauncey from the Injecting Centre in Sydney has often commented that North Richmond and Abbotsford has the ingredients, the exact ingredients that not only the Sydney Centre was set up to address, but also most other injecting centres throughout the world have been set up to address, and that is an open drug market. Buying and selling of drugs is in public view. There are people who buy drugs, inject in public. There's discarded needles and syringes everywhere. There's high levels of overdose, high levels of ambulance call-outs. Drug-affected people, they're a lot of the time mostly transient population or people that aren't really connected to the area. So we know that most of the drugs that are sold in the area are sold by people who either live there or nearby, but most people that use come from elsewhere. So in terms of the ingredients for an injecting centre, it's certainly a location that warrants that response. So if you can go to the next slide, please, Chloe. So one of the issues that I guess in my presentation at VADA that I wanted to highlight was that this growing imbalance in the national drug strategy approach of harmonisation. So harmonisation was the policy that was developed in the late 80s, early 90s, and it was our overarching approach towards dealing with illicit drugs. And it was supposed to be a balanced approach. We were supposed to have a balanced approach of harm reduction, supply reduction, and demand reduction. I won't go into the details because you can read them there in front of you, but harm reduction was always seen as being a vital component of our national approach. In fact, harm reduction was really when harmonisation started. If you go back to the mid-80s and the establishment of needle and syringe programs to address the issue of the spread of HIV, in terms of I guess the approach which was at the forefront of our efforts to address the spread of HIV, harm reduction has probably saved more lives or reduced more illness and disease and injury than a lot of other strategies. It's effective. It's the evidence is very strong for harm reduction, whether it's needle and syringe programs, methadone, condom distribution. So harm reduction has always been something which Australia has really established its reputation on in terms of effective ways in dealing with illicit drug issues. However, it wasn't until, can I go to the next slide, please?
Yep.
It wasn't until the late 1990s and early 2000s when we had, I guess, a very conservative government that we had this kind of backlash against innovative or progressive approaches towards reducing drug-related harm. And it really has been the same ever since the early 2000s. In 2001, the Injecting Centre in Sydney was set up, and we really have been in a holding pattern ever since. When John Howard took up the position of Prime Minister, he shifted the emphasis away from health back towards a law enforcement approach towards dealing with illicit drug issues. In fact, even in Parliament, he criticised his own policy of harmonisation. He was determined to set an agenda that was very much based around law enforcement, abstinence as really the only viable outcome or the only sort of promotion in terms of illicit drugs. He particularly disliked programs such as heroin prescribing, and in fact, I think he also had a distaste for needle and syringe programs, which had to be re-evaluated on 2 occasions to demonstrate their effectiveness through the return on investment evaluation. So you started to get this conversation or this policy narrative around harm reduction, which was very much, as I said earlier, around those types of programs undermining the anti-drug message, sending the wrong message, putting up the white flag, giving in, all of that sort of kind of drug war propaganda, that drug war rhetoric, which John Howard used quite effectively, and particularly when the heroin started to dry up. We do know that law enforcement, Border Patrol, Customs only sees a small amount of drugs. He credited the heroin drought purely to the efforts of law enforcement. So you've got 2 situations here. You've got a Prime Minister who was very determined to ensure that the conversation about illicit drugs went very much back into the supply reduction, law enforcement, perspective. But also you had, at the same time, the heroin drought, and he moulded those 2 issues together very, very cleverly and very effectively. And every state government and federal government since that time has done exactly the same thing. And the same policy narrative is working today that he adopted back in the late 90s, and it still impacts on harm reduction, and it's probably one of the most significant reasons why we don't have an injecting facility in North Richmond, is because law and order and drugs is what governments have invested in. That's what they bought into, and they're not prepared to shy away from that. So anyway, getting back to this, maybe the next slide, please, Chloe.
Mm-hmm.
So just to reinforce that, if you look at the spending on harm reduction, it's pitiful compared to law enforcement. I think law enforcement gets about 2/3 of the budget in terms of dealing with drug issues. Treatment receives a very small amount. Prevention, you don't even hear about prevention. No one talks about dealing with the people issues. We only ever hear about, law enforcement. And if you see any government announcements in terms of funding, the majority of funding goes towards law enforcement. So that's what we're up against, and that's part of the reason why it's so difficult to get programs such as injecting facilities, into the public realm in terms of debating, because so much of that debate is taken up with law enforcement. Next slide. So as I said, this is reflected at the local level with the continued efforts that we've had in terms of getting an injecting facility up and running there. So as I mentioned earlier, there's still a lot of resistance at the political level. It's still a case whenever you mention the issue of supervising injecting facilities, or you mention about alternatives to dealing with illicit drug issues, and it's the same for it's the same situation in terms of drug testing, pill testing. It's very, very difficult to get a considered, informed, evidence-based debate, going in the community. It's very easily cut down, very easily dismissed, and then the whole debate is shut down altogether. So that's what we're continually up against. We try consistently to get some policy dialogue or policy conversational narrative going around this issue, and at the same time, still highlighting the evidence that's there. And as a number of people have said, evidence will only get you so far. It'll get you into the conversation, but won't necessarily change the way in which people respond towards illicit drug issues. You've got to remember that there's a lot invested. There's been a lot invested over the last, nearly 20 years now since John Howard, steered the ship in a different direction. And that investment, there's a lot at stake here for a lot of people. A lot of politicians have put, their reputations on the line in terms of the way in which we respond to illicit drugs. And, to say that investment hasn't worked or is failing, a lot of politicians aren't prepared, or very rarely prepared, to say they've made a mistake. And I can't see them make a mistake. It's just, I guess, from our perspective, finding that issue, or finding that topic or number of topics that will help them shift or feel more comfortable with making a change in terms of the way they see the issue, and also their policy responses. So next slide.
Is there a bit of a delay on those slides? Yeah, okay.
Okay, that's all right. I'm cool with that. I've mentioned about North Richmond. I've mentioned the geographic environment. I've mentioned about the people that go there. And again, it's that sort of environment where consistently throughout the world, if you look at Canada and Sydney and parts of Europe, wherever you go, where the sort of environment exists that is in North Richmond now, injecting facilities have been established. In terms of the coroner's court, if you look at the number of overdose deaths, particularly directly related to heroin, indirectly related to heroin and pharmaceuticals. If you look at ambulance call-outs, we've got the highest for heroin and benzodiazepines. We come second overall in the whole state for illicit drug call-outs, next to Melbourne, which is a far higher population, and also higher numbers of people that come into the city. So the evidence is clearly there. It's an issue which is constantly in people's minds because it's constantly in people's faces. So next slide, please. We've mentioned about overdose deaths. We know that between 19 to 25 people die each year on average in a particular geographic area of North Richmond. We know there are other people that die outside Yarra who purchase their drugs in North Richmond. We know that there's frequent ambulance attendances in the area. So so people are still dying, despite the best efforts of a number of agencies. A number of agencies have been involved in educating people around naloxone, but it's a very, very difficult environment, and people will often change drugs. They'll use heroin. If they can't get heroin, they use something else. If, for example, they may use whatever drug's available, the cheapest drug that's available. Often their tolerance will drop quickly. Then they'll use heroin again. You may come back, a little bit stronger than before. They may be using other drugs, such as benzodiazepines, alcohol, etc. So, overdose is quite a complex issue, and despite the fact that people will say, it's pretty easy to deal with someone who's overdosed. You just give them some naloxone. The fact is that people who use illicit drugs in that context have very complex lives, and they do rely a lot on what drug is available, and often that means that the way in which they respond physically and the risks that they place on themselves in terms of the variation in purity and the other drugs that they're using, and also the periods of maybe abstinence where their tolerance is low, and they go back to using heroin, it causes overdose. So, and that's a reality. Next slide, please. So there's again, it's widely acknowledged that people come from all over Melbourne to purchase their drugs in Yarra and use in that area. And people obviously use the needle and syringe program to get clean injecting equipment. Has a very, very high turnover in terms of numbers of needles and syringes distributed. And yeah, they then leave and then they go out onto the street once they've got their clean fits and use the drugs in close by or in a place where they know that's safe. So there would be at least 15 to 20, if not more, areas within, I suppose, 500 metres of the needle and syringe program where people can use their drugs, and they want to use them in a safe place. They want to use them in a place where they're relatively out of sight, and obviously they don't want to get caught by the police with injecting equipment on themselves. So they get rid of their needles and syringes they've just used very quickly because they don't want to be caught by the police or hassled by the police and go through that process. So if there's 70,000 needles and syringes being given out, quite a few of those, about half, are disposed of in sharps containers or returned. The rest of them are obviously disposed of in the street around various places in North Richmond, Abbotsford, and other places around Yarra. So yeah, so you see it all the time. Next slide, please. So this is a sort of scene that we see quite frequently in lots of places around North Richmond and Abbotsford. Needles and syringes discarded. As I mentioned before, there's probably 15 or 20 of these sites, maybe even more, around the area. You see needles and syringes, and the contracted agency that is required to pick up the needles and syringes do street sweeps at least twice a day in some of the major hotspot areas, and you'll go to places where even though you don't see needles and syringes, you'll see everything else: wrappers, swabs, the orange stoppers at the end. So you won't actually see the needles and syringes, but you'll see the evidence. And I know a lot of people in North Richmond say, well, it's good not to see the needles and syringes, but people are still using because all of the other stuff is there. In fact, in that photo, you can see the balloons, the red, at the bottom of the slide there, you can see the part of the red balloon where people keep the heroin in, and so the evidence is everywhere. Next slide. So that's just another slide as I showed before. Next slide. So this is next to Lou in Victoria Street. This is frequented, this is a very busy spot. People will come and go from this place all day. It's obviously it's obviously a safe place. There's a good chance of being found if you overdose. You're out of sight. It's relatively sterile. It's clean quite often. But if you stand around there and as I've done on many occasions, people just come and go, and it's pretty constant, in terms of injecting. And I just think it's appalling, and it's not only for the people that are using it to inject, but also people actually want to use it for a toilet. I just think it's people should be able to go and use a toilet without having to find needles, syringes, and often blood all over the floor, which I've seen on a number of occasions. So it's just not a good situation, and it's not a situation which people should have to put up with, quite frankly. So next slide. So this is just some shots of the back streets and laneways of North Richmond. As you can see, this is an overdose situation. On this day, 2 ambulances went to an overdose of a young woman. I happened to be nearby, but you can see how where those rubbish bins are on the left of that car is how that would, and the woman who overdosed is just on the other side of that car on the left. You can see how quite easy it is to be out of sight in a place like that, and there are literally dozens of laneways like this throughout North Richmond at the back of Victoria Street. I've spoken to ambulance officers. In fact, I spoke to an ambulance officer once who couldn't get over the fact that the person who had overdosed, we were chatting about the woman who had overdosed in a supermarket not far away from here. They couldn't get over the fact that this young woman hadn't used the injecting facility. And I said, well, there isn't one. And she said, oh, I thought there was. I thought they set one up ages ago. I said, no, they haven't. She said, well, they should. They should set one up straight away. It would save us time. So, there's strong support from ambulance, from fire brigade, privately police support it. It seems that overwhelmingly there is community support for this approach, but trying to get some political change has been really, really challenging. Next slide. So, look, a lot of this I've been through before. We are talking about many people who are disadvantaged, marginalised, vulnerable, using on the street. They have multiple issues, and using an injecting facility, as they have found in Sydney, provides a bridge not only to treatment, but also to other social welfare health services that many people who are injecting drug users, particularly street-based injecting drug users, don't often have an opportunity, or often are turned away from mainstream health services. So that's a really important component of injecting rooms, that they can build that relationship with marginalised people and provide that assistance when people are seeking that type of assistance. Many do have multiple and complex needs. In terms of the impact on the local area, an injecting centre would move the problem off the street. There would be obviously far less injecting. There'd be far less drug-affected people. It would improve the amenity, less pressure on ambulances, emergency services, police, etc. Police won't have to get, or won't be called, or less calls towards particularly public nuisance issues around drug-affected people, that type of thing. So a lot of health agencies, in fact, most health agencies, VADA and others, have come out in support. Recently, there was a campaign through the media and Herald Sun with a number of agencies. 46, I think, signed up to support for a proposal for an injecting room. This came about because of an inquiry last year by the coroner into the death of a young woman in a, well, she actually died in hospital, but she overdosed in a toilet in a fast food outlet in Hoddle Street. The inquiry basically came up with a number of recommendations. The number one recommendation was that an injecting room be established as a trial in North Richmond. Again, it was met with a negative response from government, so even the coroner's recommendations are being ignored. There was a campaign in the Herald Sun which was very, very positive, very good editorial, a number of opinion pieces, and as I said, we were at that point where we can't identify just what the issue is that is preventing from this going ahead. We have never been told why this has not been supported by the government. There doesn't seem to be any reason why this isn't going ahead. Next slide. All right, so the evidence, and I think I'll need to wind up soon because we'll need question time, but the evidence from consumption rooms, and call them whatever you like, consumption rooms. I know in a lot of places in Europe they allow smoking of drugs. We're obviously talking about an injecting facility, but overall, in the literature that I've read, and I read it today, there have been no fatal overdoses. There are overdoses, but they're managed within injecting rooms. Reduced public injecting, that's one of the major outcomes from the Sydney evaluations. Reduced discarding of needles and syringes, less litter on the streets. Reduction in emergency services demands. It actually changes people's injecting habits, less sharing of needles and syringes. It doesn't cause the honeypot effect that people say it will in terms of dealing and increased use. There's no additional crime. And I've talked about the other aspects from that as well. Next slide. So finally, I think this is just about the last slide. Moreland Hall, once the council in Yarra voted in support of an injecting room, there was an advocacy campaign run by us, and a number of agencies provided support to that. And Moreland Hall conducted a survey of a number of their clients in terms of their attitude towards injecting rooms. And I think this quote, really kind of sums up or provides a particular perspective that often we don't think about or we don't think about enough, which is about providing something to a group of people that have had a lot of things taken away from them. They're ostracised, they're stigmatised, discriminated against. They're treated, in an appalling way by the community. And for many of them, it was a case of, well, at least if we have an injecting room, it shows that someone is interested in saving our lives, and we might be treated a little bit better, and it's a more humane approach. So, the human rights issue is something which we're now looking at. In Canada, there was a Supreme Court decision about the injecting centre in Vancouver, which the previous government in Canada tried to shut down. They appealed that decision to shut it down to their Supreme Court. They have a human rights charter, which is a lot stronger than ours, and they won that case. So maybe that's something that we need to also look at as well, that we need one in terms of the human rights needs. But I think that's the last slide. Just check if you can, please, Chloe. And I'd like to finish there. I'm happy to answer questions. So, yeah.
Great.
Thanks very much for letting me have this time.
Thank you. Yeah, it looks like we've had a few comments and stuff like that through here as well, which is good. Maybe we can put back on these.
The first question that we had, Greg, was just around like.
Do you want to talk up a little bit, Ash? Do you want to speak into the microphone, maybe?
Can you hear me well now?
It's still a bit soft.
Yeah. Okay.
What's going on there? Can you hear me, Greg?
Just. It is soft, but I can hear you. Yeah. Go ahead.
So we had a question from Nathan about what the key was to getting community support, getting people on board with it. And I guess there's two different questions there. There's the question about the people in the immediate community in North Richmond, and the broader question about community support, like I guess across Victoria.
Well, look, I think one of the keys to all of this has been the direct work that we've done with a lot of people in the area. And that means actually going down and meeting people and holding meetings and using different avenues that are available to get this message across. I've had a number of meetings with people from the Traders Association. We held public meetings at North Richmond Community Health Centre. I've gone into shops in Victoria Street and spoken directly with a number of the traders. We've advocated a lot through, other forums such as the Local Safety Reference Group, which is run through council. There are 3 housing estates in Yarra, and I've been to each one of those. I have to admit, though, that the one at North Richmond has probably been the most difficult to work with because the issue of public injecting has impacted upon them most significantly. And and there's times when we've worked with the Department of Health, and we've said things which they don't like to hear. That we disagree with what the government's saying. We want further engagement on this, and we've worked with the media. We've got a number of people who are well respected in the area to be interviewed. We've worked very closely with The Age, with the Herald Sun. We worked very closely with Leader when it was running. It's not running anymore. So, and also the police, the police will say things, in meetings and privately, and, they haven't opposed what's going on down there. They do have to follow the government policy, but, overall, they come to our meetings. The Yarra Drug and Health Forum meets once a month. We have community forums. We held 4 last year. We had a major community forum, which we publicised quite broadly around the need for harm reduction. So, I think it's just that you need to work on multiple strategies, and you need to really listen to people. And, I've worked a lot in advocacy. I worked in and still work in Southeast Asia, and I worked, in areas where HIV was policy was really challenging. And, you've just got to start the conversation and get people's interest. It's a bit like a cold call, when you get that cold call and people will ring you and say, are you interested in buying whatever? The way you start that process is that you start with a conversation appealing to their needs. You then listen to them, and then you identify what their issues are and have your advocacy strategy ready to address any concerns or misconceptions, misunderstandings that they may have. So the longer you can engage someone or a group of people in the conversation, the more likely you are to bring them around and to address that opposition. But one of the major, I guess, changes over the last 12 months has been the development of a residence group. And, I've worked with a couple of people on that residence group, one in particular who I invited to, a community meeting about, 18 months ago. And there was a lot of people in the community and traders who up until probably 2 or 3 years ago thought the problem was going to go away. They thought, well, eventually this is just going to move on. It's going to be like Footscray. The traders in Victoria Street thought it's going to be like Footscray. They're just going to put up cameras and, the problem will go away. But I think now, in fact, everybody in the area is convinced that it's there to stay. And I think that was a real change, that, the biannual police crackdowns that were supposed to get rid of the problem and disrupt the market, were just having no effect. They were pushing it further out, and then it was coming back in again. And we started to get that evidence across. We started to highlight that. We started to show people and tell people that even though the police have a role, they to a certain extent, there's an expectation about what they will do. It isn't going to change the situation. In fact, it's going to make it worse. And we started to show the evidence. Things on our website, fact sheets, access to information, taking people around. I've conducted countless tours with people from a whole range of agencies, some of whom were sceptical about the situation down there. I think that's kind of all culminated around this. I was on 3CR today talking about this very issue, so I've been on 3CR on other occasions. So, I think that eventually it has to have some traction, and it certainly has been, gaining traction. And I also think too that political opportunism. We've got a very supportive, group of politicians in Parliament at the moment who are determined to make this work, and I think that's, that again is something which is also influencing the community in terms of the way they support this.
Thanks, Greg. We had another question from McBain around, speaking of evidence, and that was around, I guess, some economic modelling, maybe some cost-benefit kind of studies, which might kind of compare the cost of running a service like this with the actual dollar value of the savings that you would make. So in terms of the saved money cleaning up syringes, ambulance call-outs, disease burden, all of those kinds of things. Is there any solid research on that side of things?
Well, I certainly think the Injecting Centre in Sydney has done some economic modelling. I certainly think in terms of changing people's behaviour around injecting. And look, one of the things that they do acknowledge is that they have, I forget how many clients, 15,000 clients spread over 12 months. that people don't just inject in the centre in Sydney. They also inject in in their homes, etc. And also use the injecting centre. But certainly, economic modelling would be a big advantage. We've looked at it a couple of times. I know that there's been an estimate put on the saving in terms of ambulance call-outs, and I think it's quite a significant amount of money in terms of reduction of ambulance call-outs, fire brigade call-outs, etc. So I don't actually have any economic modelling, but if anybody's prepared to do like a pretty comprehensive modelling on that situation down there, I'd be very, very happy to speak with them. I know there has been some, not only in Sydney, but also other parts of the world. But an economic modelling on North Richmond would be, would be very well received. No, I'd be full of gratitude if that could be done. So, if anybody's got any suggestions, please by all means, get in touch with me. Yeah. Any other questions?
Excellent. Thanks, Greg. We haven't had anyone post any other questions. How are you for time? I'm just aware it's coming up to 9 o'clock if you have other things you need to be doing this evening.
Me?
Yeah, you. Yeah.
Oh, sorry. Yeah, no, I'm okay. No, I'm just looking for one of the McBain's question. I love the name, McBain. Yeah. I'm trying to read the whole question because there's a lot written there. Sorry.
Yeah, I did try and summarise it a bit. Gulliver's just posted a question under that as well about whether it will or won't increase the amount of traffic in the area in terms of people coming there to inject drugs and that kind of thing.
No, that's look. There's there's no evidence. They often call this the honeypot effect. That the fact is that the people are already there and they're already using drugs. So someone who may be using heroin in Footscray or Sunshine, isn't going to make a decision. Oh, I'm going to go over to North Richmond from now on because they've got an injecting room. It's for people who are already there, so it won't draw additional people into the area. I know that's one of the issues that people often put up as an argument against them. One of the discussions, and I had this discussion with some traders not long ago, and they put it in a different way in terms of some of the opposition, that I've experienced with the traders, is that they believe an injecting room, and they agree that it won't necessarily bring more people into the area. The fact is that they just actually want the problem to go away. So they believe that if there was an injecting room, it would be like a welcome sign and a reason for people to still go there. Their attitude was that, no, we don't want it because we actually want to get rid of the problem altogether. And I think that they now recognise that that's not going to happen. That was their attitude all along. In fact, they've said, look, we always believed that the problem would go away. I think they were getting advice from traders in Footscray and places like that. But and look, there has been an announcement at the end of last year about a camera that's going to go up in Victoria Street. But I think even the traders recognise now that that it's going to be very, very difficult for police to respond to that because it will only be a camera that's used to investigate major incidents. It'll be fed directly into the security system in the housing estate. So, it's not going to be, and they recognise it's not going to be, the magic solution that they thought it was going to be. And most of them will say now that they're happy to have an injecting centre. They don't want it on the main street because their issue is that there are too many drug-affected people on the main street. But they said, look, if it moves the problem away to another area in North Richmond, then they would fully support it. In fact, they have come out in support of at least a mobile facility, but not a facility on the main street. They'd be happy with a static site as long as it's away from the main street. So,
right.
Yeah.
Yeah. So it's about the nuance of the location sort of thing.
I think it is, yeah. That's very much their issue. So, you know, for them, their belief is that the drug trade and drug affected people is detracting from the area, and it's affecting their businesses. So, you know, and they are, you know, they are fully supportive of anything that will move the problem away from the main street. So, and we believe that it would. We believe that having an injecting room or injecting rooms or facility away from the main street will push the market into another area of North Richmond where it has far less impact and is far less risky and harmful to not only the people that are using drugs but also to the local community. So, yeah.
Yeah. We've had another question from Nathan, and that's around Victoria Police carrying naloxone, which I don't believe they do, but yeah, how do we kind of get to that place where they do?
Well, I think it's a great idea, and I know in the United States they carry naloxone, but I think they carry a nasal spray in the United States, which is a lot easier to administer. Look, I've had this conversation before with police, and they get kind of quite uncomfortable with the whole idea. And I think, again, it gets back to the conversation or the discussion we were having earlier about how we see illicit drug use in the community. We've built up such a whole, I guess, these campaigns around, illicit drug use. It infiltrates, many aspects of the way in which we see drugs or the community sees drugs, and the police respond to that. I think a good example, and I'm just using this as an example to sort of, to draw a comparison to, was the recent situation down at the Revolver nightclub, where the police actually knew that there was a batch of drugs going around which could be harmful, and they gave no warning about it. And their reason was that, well, our message is to everyone that illicit drugs are dangerous, so don't do illicit drugs. That's all we have to do. So, when we start talking about naloxone and police, providing something which will help save lives, we've got to overcome that first obstacle or barrier about, the police attitude towards illicit drugs in general. We've got to deal with that first before we can start talking about naloxone. There have been some significant barriers created, or some significant sort of attitudinal barriers created in policing minds over the past 10 years or so. 15, 20 years ago, the attitude was a lot different. Nowadays, it seems, because the broader community isn't being impacted like it was in the mid-90s with heroin deaths, and because because there has been such a big investment in policing, and with more laws, more powers, tougher sentences, police are reluctant to look at not different approaches, but look at other approaches which could also be, obviously beneficial, but beneficial to the people that are most impacted by, illicit drugs, heroin use, which are the people that are using. So, again, these are the conversations that we need to have to try to overcome these barriers. I think police attitudes are changing. I think some of the, and they've always been the most difficult group to deal with. But I think police attitudes are changing. I was talking to someone today about a music festival that he went to over the long weekend, and he was quite surprised about the positive attitude that police had during the music festival, which was near the Grampians. He said that, he didn't see any police dogs. The police were very friendly, very engaging. There was no sort of confrontational stuff. So and that sort of is sort of backed up with recent comments by others about, police, um, not targeting people using reagent kits at some of the dance and music festivals. So maybe things are changing. Maybe they're starting to sort of also come around to the notion that we need to try a different approach. So I'm hoping eventually that police will take, will carry naloxone. We'll see needle and syringe programs in prisons. That the criminal justice system will have, a far more sort of considered and humane response to the issue. The other issue with naloxone is that, in terms of police carrying it, is that the police really shouldn't go to overdoses anyway. I know they do, and I know they come across them, and I know the public do call them occasionally, but ideally you shouldn't have police going to overdoses. It's not a place that police should be going to. So, but look, I'd love to see them carrying it. I think it would be a big step. It would be a very positive step. Yeah.
Yeah, I can validate that experience of that particular festival. I was also at that one, and yeah, like I can't really fault the cops for anything that they did on site there, and that's pretty consistent with my experience. Kind of doing harm reduction stuff in the festival setting. The police that are actually on site, the boots on the ground police, they're very rarely antagonistic to the community. I saw them escort a young man to medical who needed to be at medical, and they were compassionate and reasonable in the way that they did that. I sort of looked at the situation and I was like, yep, that's pretty much how that should be done. So yeah, I think that, I think that's true, that there are a lot of police that are comfortable with different approaches.
Yeah. It certainly helps, I think, if they're local police, if they're, if you get police from the city, particularly recently trained police, who don't have that more considered sort of, they don't have the experience, they don't have the, the understanding of the issues, but if you have local police who know the community, who, have a bit of a connection to, maybe, the agencies or the people that are running the events, I think that helps. I certainly think that helps a lot. So, yeah. It's good to know. It's good to know it is changing. So, yeah.
Do you think that that's something that's trained? I know it's a long time since you've been a police officer, but that kind of discretion in policing, is that incorporated into training and, potentially briefings for certain events, do you think, or is that just something that the police are just doing?
Oh no, I think it's in.
Depending on
I certainly think it's in briefings. I certainly think that there would be, the way the police operate is that they would be giving directions to the police, and that would come from senior level. That this is the approach that we're going to take. So, and look, if they were open and honest, which I've spoken to a lot of police about, dance festivals, music festivals. Most of them would say, well, look, quite frankly, we'd prefer them to be on a few, ecstasy tablets or, smoking a bit of, cannabis than, sinking, alcohol and fighting and doing stupid things. So, I think the police are very aware that there tends to be less violence. People, far easier to get on with, and there are far less hassles in aggro at places where people, are using substances which aren't alcohol than places where, there's a lot of stuff going on which police hate to deal with, and that's breaking up fights and, being assaulted. So, and I think, if you have conversations with many police, that they would say that, it's better to, go to an event where people are chilled out on a few eckies and go to a place where they're boozed and brawling. So, and that's just being open and honest about it. So, yeah.
being open and honest is a very challenging thing to do in this area. Feel free to jump in, guys, in the chat window if you've got any more questions. Otherwise, I can jump in with another one myself, and that's around the attitudes of the drug-using community in Richmond itself. We've talked about the community attitudes and the perspective of the health providers and service providers. Has much work been done to actually gauge the attitudes of the people who inject drugs in North Richmond and what particular model they would like to see that I guess would serve their needs the best?
No, look, it's a good point though, Ash. And it's something again which, we just assume, I guess, that people would say yes. Give us a supervised injecting facility. I work out at North Richmond Community Health Centre occasionally. I certainly have a lot to do with the staff, and they speak. The staff that work at the North Richmond Needle and Syringe program, they've all said that they want it. They believe it's warranted. I don't think there's been any formal engagement with people that use drugs in the area. Again, it's something else which I think would be quite valuable. I don't know how much attention government would pay to it, to be quite honest and quite frank about it, but certainly it would help in terms of gauging what type of model facility would be, would be most accepted or would meet the needs of people who inject drugs. When you go to North Richmond Community Health Centre and you see people getting their needles and syringes, and you chat with them, and they'll say, well, we're going over to this place today because we know the police are over at the other place, or they'll go to a car parking, a multi-deck nearby. There's some abandoned cars in that multi-deck. I guess we just assume that an injecting facility will be something which they would want because it would keep them safe, and they'd have to, or they wouldn't have to go through the whole process of injecting in public. But certainly, again, that is a good suggestion to, I guess, gauge a better understanding or get a better understanding of what what their needs are. So, but it's a lot of it is secondhand or kind of anecdotal or one-on-one conversations with users, and but in terms of a more sort of broader sort of engagement around that issue, no, there hasn't been. So, but it's a good suggestion. Yeah.
I have more of a comment to make, just on a point that was brought up a little bit earlier about where the injecting facility could be located, and about how there was, I think maybe it was the traders that were saying if it was positioned maybe a little bit further back off Victoria Street, that would be better. I still, that kind of baffles me a little bit because, if an injecting facility is there to manage overdose and to be preventing harm, wouldn't people entering a building like they do in King's Cross, where the MSIC is actually quite it's, you can hardly even recognise that it would be an injecting facility. It's very sort of hidden, just a black door, as far as I understand. If that was the front of an injecting facility in North Richmond as well, people should be able to walk in there and sort of maybe leave through a back door, or kind of come and go without it being sort of like a real visible health centre or place that was attracting and congregating people who use drugs. I think that maybe there could be some lessons from the MSIC and the way that they've managed to position it in such a busy street in Sydney, in a way that could definitely kind of be transferred to North Richmond. And I suppose the other thing is that if it was to be positioned further away off Victoria Street, depending on how far it would be, maybe that would actually detract some people even going to it. You know, I suppose it's all a little bit of hearsay because it depends on what the location would be. However, I don't know, like personally, just kind of felt that, you know, this notion about it needing to be not on Victoria Street or needing to be away from, you know, the general hustle and bustle in some way. I mean, if it was too far away, it could kind of defeat the purpose of it being in that busy area.
Yeah, look, I agree, and it's not the option that I would go for, but that's what they're saying to us. And you know, I guess in every um, conversation you have about this issue, that you try to look for some kind of compromise. And I agree with you. I think the drug trade will still be in Victoria Street. There will be still people buying and selling drugs, and if we have it as part of the North Richmond Community Health Centre where needles and syringes are provided, then people will still need to travel there. And it's still going to have, it's still going to have its detractors, even if we have it in the North Richmond Community Health Centre. I know the Office of Housing, for example, the Department of Health and Human Services, I don't think they're all that keen on the idea of having it as part of North Richmond Community Health Centre. So finding the ideal location has always been a challenge. It's always been the difficulty. And, I guess, in terms of the Sydney experience, and I've been to Sydney and seen how it operates. It does work in terms of people going into the centre, going out the back, and then leaving through an exit at the rear. Um, you know, um, and there doesn't seem to be any. Well, in fact, there isn't any trafficking that I've seen, or selling, or buying, or whatever. In and around the front of King's Cross. And I think that North Richmond is a very different geographic or structurally, or the built environment is a lot different. There's also been a lot of gentrification in King's Cross, which has changed the profile of the area significantly over the last nearly 20 years. So yeah, look, these are really important points, and it's all really good conversation, and and it's always been something which has been in the back of our mind. But I think also too, without I think your question is a really important one. But also, to me, I've always tried to focus on establishing the need and presenting the evidence and talking to people about it and getting them to the point where they actually say, look, you're right, we do need one. And once people make up that decision, and then if we can get the government to at least acknowledge that and say yes, we can then work on the model. We can then work on what it is that's the best fit for that particular area, in terms of what, meeting everyone's, trying to reach a compromise on what it might look like. Now, we've talked about a mobile facility in conjunction with a static site. We've talked about, a site that already exists in Lennox Street, which is just around the corner from Victoria Street. So, I think this is something that we would need to have a discussion with, but we need to get to that point where they actually say yes. And everything after that is open to negotiation. That's my attitude, I guess. I don't know if that answers your question, but yeah, I do take the point. It is an important point, and I don't want to build up people's expectations. And I don't want to tell people that, okay, if you have the site, all your problems will disappear. It'll be gone forever, because it won't be. People, they use the trams, they use the buses, they use the trains. It's a really complex environment where people come in, obviously, also to sell. So all of that sort of stuff around, where does that end up if it's moved, or if the market moves over to a place where there's an injecting centre? That I don't know. I don't have the answers necessarily to that. I wish I did, but I don't know. There's some stuff which I have to say, look, I'm a bit unsure about that. Because we've always been sold this notion about, winning this. It's always been the conversation about this is the answer, or this is the solution, or this is the way we will win it. So many people have that mindset that when you start talking about injecting room, they immediately think, oh, okay, that's the answer to the problem. And I say, well, no, I'm telling you that this will significantly reduce the risks and the harms and the problems that you're experiencing. It's not the answer to the problem. It's a way in which we can deal with the problem that we've got and manage it better. But I don't have the answer to the problem, because that's a far broader debate around drug policy and, which is one I love to have, but it's I don't want to cloud or muddy the water with the introduction of a whole range of other stuff, policy conversations, which will, divert attention from the fact that, we need to deal with what we've got down in North Richmond. So, it's a bit like telling someone who's got, a very bad disease that, okay, let's not talk about your disease. Let's talk about let's not talk about, trying to address your disease. Let's talk about, your diet, or your lifestyle, or that type of thing. Let's just let's just deal with what we've got for now, and then we'll work on the other stuff a bit later at the time. Do you know what I mean?
How are you for time now, Greg? Have you got time to answer another one? Okay.
Yeah, another one.
Yeah. Okay. So yeah, there was one more question from Gulliver, and I guess it's well, he's put it as a legal, medical regulated heroin. So probably the model there is a prescription heroin program. Does that ever come up when you're talking to people, traders and residents?
Look, it does. It kind of, it's a little bit about the conversation we've just had, and certainly if you, get asked questions about, what's your thoughts about how we can address this issue better, or what can we do, to really, address the issue. I will mention things like heroin or opiate maintenance programs, that type of thing. So, and I think that that's something that, we've certainly advocated for in the past. And I always say to people, look, if you firmly believe, or if you think that that's a strategy that you would support, you need to talk to people that can have some influence over that. So writing letters to, politicians, to the media, don't speak to people like me who are already sold on the idea. You need to talk to the people that make these decisions, and can be influential. And that's obviously the politicians, and it's the media. So, and start an advocacy group. Start your own advocacy group, as the people have down in North Richmond and Abbotsford with the residents, and become involved in the conversation. But certainly, from time to time when you're having a more sort of broader discussion, or you've been talking to people for quite some time, and that issue comes up. Because I know, for example, the police will raise this quite a lot. Police will say, well, an injecting room's fine, but we're still going to have people around here that are using drugs. Now, what we should be doing is we should be giving people heroin. Let's just give them heroin. And then we know that our issue, or part of our issue, will be addressed, which is the crime. So they'll complain about the crime. They'll complain about people breaking into cars and houses, and robbery and all this type of thing. So so yeah, certainly, when it comes up in conversation, we haven't had we haven't been really pushing it. It's certainly something which we do support, but it's interesting, heroin prescribing, because it almost got up in Canberra in the late 90s, and again, John Howard, and I mentioned this earlier in the presentation about his opposition to it. I think internationally there's more of a movement around these types of programs, because it's also been really tough internationally through the UN system over the past 15 or so years. It's the INCB and particularly the INCB has constantly criticised governments who support or run heroin prescribing programs. So, and often it's about the political timing, and I think politically the timing is pretty good at the moment. Federally it's pretty good. We just had Malcolm Turnbull, asked to comment on the injecting centre in Sydney, and I can't remember. I think it was on 3AW, or maybe it was.
It was on 3AW. Yeah, I got the transcript so I could transcribe
he said,
it.
and it's in its electorate. So he said, look, as far as I'm aware, it's working perfectly well. So, that's a lot different to what others have said. So, sometimes it is about that timing. Sometimes it is about those kind of pieces of the puzzle coming together. I don't know who is actually, apart from maybe a couple of agencies such as Australian Drug Law Reform Foundation and maybe one or two others. I don't know if there's a concerted effort, coordinated effort around heroin prescribing in Australia at the moment. I don't know who's kind of driving that. I don't know. It certainly does come up from time to time, but it's not something which, as far as we're concerned, is something which, is going to be at the forefront of our advocacy efforts. We're spending pretty much most of our time looking at the injecting room. So,
yeah. Okay. Well, I think we'll leave it there and let Greg go on to other things that he's got to do. Do you want to close out the webinar, Chloe?
Yeah, sure. I think we just wanted to say thank you. Thanks for joining us and presenting those slides. Penny and I were lucky enough to be there and seeing them at the conference and stuff, but it's really, great to actually have them, available to students as well, and to everyone who's seen them today. We will put them on the internet as well, so they'll be accessible to other people if they want to have a look too. And thanks everybody for coming. It was really excellent, and it's always so good to hear people's questions and have that dialogue sort of continue on after a presentation like this. So yeah, thanks heaps for your time, Greg, and everybody for attending.